5 ways presenting the ideology of reproductive medicine as an alternative to evidence-based fertility care creates a problem. Number 1, ideological framing replaces medical framing. When reproductive care gets politicized, policies start being written based on beliefs about embryos, conception, or natural reproduction rather than medical evidence. For example, if lawmakers adopt definitions that life begins at fertilization, embryos in IVF labs may be given legal person status, which complicates embryo storage, testing, and disposition. That can make clinics and patients legally vulnerable for routine practices like freezing, discarding, or genetically testing embryos. Number 2, restrictive legislation bleeds into IVF. Even when laws are intended to target abortion, they often sweep up IVF unintentionally because both involve embryos and reproductive autonomy. After the Dobbs decision, some state laws created uncertainty about whether embryologists or patients could face legal risk, and we saw that happening live. Clinics in certain states have had to pause services or modify protocols out of fear of prosecution. Number 3, insurance and funding implications. When reproductive care is politicized, coverage often depends on ideology rather than need. Some states or employers refuse to cover IVF if it's seen as destroying embryos. Conversely, RRM-aligned programs may be funded instead, despite limited evidence for their efficacy in fertility treatment. Number 4, misinformation and stigma. Politicization fuels misinformation about IVF, like claims that it's unethical, unsafe, or casually discards life. That stigma can discourage patients from seeking care or embolden legislators to impose restrictions. It also puts fertility specialists in the crosshairs of public controversy, complicating advocacy for patients. Number 5, erosion of patient autonomy. When policy is driven by ideology, patients lose the ability to make personal medical decisions about how many embryos to create, test, or transfer based on their own values and circumstances. This can be especially harmful for people with infertility, LGBTQ+ families, or cancer survivors who rely on IVF for family building. In short, politicizing reproductive care, including through ideologically driven RRM frameworks, shifts controls from patients and physicians to politicians and belief systems, and that's what ultimately threatens access, safety, and innovation.